close to your microphone, Joseph. Good.
Tumesanitize.
Umesanitize? Okay. So, Daktari, you want to say something? Yeah, you can say something. Yeah. No, it's okay. You talk fast.
Okay.
Yeah.
Good morning, ladies and gentlemen of the press.
Louder.
Good morning, ladies and gentlemen from the press. We want to welcome you to this press conference where His Excellency the Governor will give us details on how we are dealing with the coronavirus disease in Nakuru County. He will also mention to you the confirmed cases that we have, and maybe you are already aware because it's in the public domain that we have 2 confirmed cases of a male and a gentleman who are already under our care. And I would want to insist to you that we want to give our public the same good old instructions about how to prevent ourselves from getting infection. And I repeat it again here at the risk of sounding repetitive, that we want to ask people to stay at home. We also wish to ask people to have social distancing, hand hygiene, and now to appropriately wear face masks in the circumstances as instructions given yesterday. We wish to let everyone know that for the cases, the positive cases we have, we are taking good care of them, we are managing them, and they are all in stable condition. The county government, as His Excellency will say, is fully prepared to do health promotion, prevention services, and to offer clinical services to all the clients who end up in our facilities in the public hospitals, and we have managed to get all the equipment that we require for now. However, I will be quick to add, just like everywhere else in the world, we don't have enough of everything that we require, but we are acquiring them as we go along and on need by need cases. So I'll now welcome His Excellency the Governor to talk to the press. Welcome, sir.
So thank you, Doctor. Confirm that we now have 2 cases in Nakuru, one for a 28-year-old lady and a 39-year-old gentleman who confirmed positive yesterday. Both were on quarantine. They were in isolation in their specific homes. And by the time we got the results, the information reaching us was that there are also other people who may have come into contact with them, and that we are therefore currently tracing those who suspect themselves to have been in contact with confirmed or suspect, to call a number that we have already shared with the public, with a view that our ambulance can come and pick you from wherever you are, and that we can be able to address the medical circumstances that you find yourself in. But you find some of these people, when they think that, they take a matatu all the way from Lanet, come probably take another boda here, go to the hospital, come into contact, and they think or suspect they have come into contact. Getting to see your parents, your family, your neighbors, your friends, and so on, becomes a very, very big damage to the society. So we are calling upon all those who are on quarantine and isolation to respect the terms of the isolation, so that you're not in isolation and in the evening you want to go and see a friend, you want to meet your relatives, you want to meet your family, because eventually in some of the cases you find one person has a web of over 100 other contacts that they have come into social distance within the last 14 days. So I think this is really a plea to all those who are suspected and are in isolation to respect that. And even in these 2 cases, when we get the full details, we shall share. But there are clear cases of violation of the quarantine terms, and that puts the whole society at risk. Then we also would want to share that we are currently having a curfew in the evening, but during the day everybody is doing their normal business. So people go to work, we may keep the social distance, but the reality is that there are times when there have been major lapses, both in our public transport system, at home, and all other places. So I think also as a county and also looking at what has happened in other countries where the authorities were reluctant to put a total lockdown from the start. Those countries that went half measure, those countries like China initially and also Italy, the results, also Spain, the results were disastrous. Unfortunately for us in Kenya, we have taken a similar path where we want to take half measures, where we allow people to be on lockdown at night, and during the day we are all over. Yet we are being told on the same breath that the virus now is at the community level. The infection is now at the community level. So we are also calling for a total lockdown. We would rather fight the consequences of hunger than the consequences of 10,000, 20,000 people infected. And we have seen one person can infect over 100 people within a very short span. Those 100 people can also infect another 100 each. So the wave is... We have taken a similar path where we want to take half measures, where we allow people to be on lockdown at night, and during the day we are all over. Yet we are being told on the same breath that the virus now is at the community level. The infection is now at the community level. So we are also calling for a total lockdown. We would rather fight the consequences of hunger than the consequences of 10,000, 20,000 people infected. And we have seen one person can infect over 100 people within a very short span. Those 100 people can also infect another 100 each. So the wave is going to expand, and within another 1 month, it will be a total chaos here. Our capacity to manage medical cases that require ICU is very limited. Therefore, if we continue to allow these infections to go on, as is the case right now, then we will be staring at a total disaster in a few days to come. There are also instances where the public, notwithstanding all the education, the awareness that has been carried, are living as if the COVID-19 does not exist. Yesterday I had a team of beauticians and salonists who are here protesting that we have closed their businesses. And it is obvious that you cannot shave somebody when you're more than 2 meters away from them. You cannot plait their hair when you're more than 2 meters away from them. I'm told for the ladies, if you're plaiting the hair, it can take up to 4 hours when you're literally breathing into each other. So they would want us to continue with some of these businesses. Yet in another 2 or 3 weeks, when we'll be talking of Nakuru, maybe 100 or 200 people, the same people will complain. So I think our plea to the national government is a lockdown is inevitable. We would rather have a lockdown now when our numbers are within the 100 or so digits than when we are 10,000. So why have half measure when you can go the full hog? The social structure of our population is such that over 70% of our people are in rural areas where the social interaction is fairly limited. The bigger challenge is in the 30% of the people who are in our urban areas, the urban poor. And I think if we can work together with the national government, with the private sector, we can address issues of food and access to those communities so that we can deal with the issue of food access to those people, the urban poor, and therefore ensure that this thing does not go. It is easier to deal with hunger than to deal with COVID-19. And I think this is a choice we have to make as a country, because we cannot do a lockdown for Nakuru alone. We have attempted to do screening for passengers on PSV coming to Naivasha, also coming to Nakuru. But as you can agree, it's a porous county. People can come from all directions. So we cannot do it at a county level. This must be a national initiative. And I really want to urge the Minister for Health, and the President as well, to save the country now than when it will be too late. And I think these are issues we really must say require immediate and urgent attention. Thank you. Any question, or we are through? And you also, members of the media, you have to agree. fighting together with the COVID or against the COVID. Correct? Yes, the other day I saw you are covering 100 people together. You know, we must really work together. Yes.
We have the street children and street families. They have raised concern over being covered by members of the security. They have been beaten up. Some are forced to go and stay in crater, that is the guide crater, where they are wondering why that is. When I asked the commissioner, they say the responsibility of the health government of Nakuru to look for a place they can be rehabilitated and also they can be quarantined in case they need to maybe have the access to water, access to food, access to maybe this medical things. Is it possible for them to be given that and what are you doing as a health maybe to look into their welfare?
What else?
About the preparedness of the public, how many we are doing as I'm thinking about. And then secondly, the state of the family of the patients that we are next. How is it like? Are they being taken to hospital or recovery? And how your contact tracing?
Is that all? Okay. Okay, so with respect to the street children, among other vulnerable groups, because they are also old persons, they are people who are also disabled and so on and so forth, we have done a budget proposal that we hope will go through, and some of the areas say some of these children have family connections. I think this is the time that we would want to ignite them. We also have day scholars, children who come from home, come to the streets and later go home. So we are trying to isolate some of these numbers and find a way of dealing with them. With regard to the families of the 2 confirmed cases, I have said that we are already doing the profiling, which would mean that we want to see where you are staying, who you have met in the last 14 days and so on and so forth, with a view to also getting them under isolation and observing them for the period. But like I've said, the web can be very long, very long. 100 is the minimum number. We are talking of a very huge number because some of us are not respecting the terms of isolation. So even if we've told you to be in isolation for the 14 days, you still meet your family, who later go and meet other people. You have an uncle or brother who stays with you, who again has to go to work. So again, the exposure is too large. And that's why we are saying, and just good to mention that the lady came from Mombasa. So again, if we had done the lockdown at the right time, she would not have come there. We'd have dealt with that problem there and we would have solved it. So this issue of lockdown is going to help us solve a lot of issues. And all these other people who have later had contact is because they are all able to move within this particular period of time. If there was no movement, we would be dealing with a small web of 3 or 4 or 5 people, and therefore the exposure would be very little. So I think that's really the big issue that we must emphasize, that the movement is still there during the day, at family level, and even sometimes at night, and that continues to be a major risk to our people. Oh, yes. Yes, 7. Yeah, how many?
ICU beds.
Yeah.
The ICU beds are one we have in the county government and 6,
Yeah.
and in the private sector they are also 6.
Yeah.
And then
Ventilators?
Ventilators
Mm.
are from the county government, they are 9. In the public sector, private sector, they are about 6.
Okay. So I think the reality is that there are very few ICU beds. If you talk about 7 ICU beds, if you're in a situation where you need 100, it means all the others will not get it. And that's why we are saying the margin of prevention. But once we get to that stage, it's a totally different story. The ventilators, we have about 12. 19, we also have private sector, but whatever number we get is at the ocean. It's not even 5% of what we may require. So I think our plea to everybody is to work at this prevention stage. And it's also good to note we don't have all the capacity to do testing. And even great nations, including the United States and the UK, we would really want to encourage that if you have a family where you have old persons, it's also that they remain under some sort of isolation of sorts, even if they are not sick. Because as has been said, it gets worse when you're treating people with advanced age and also with other pre-existing conditions that would make it very difficult for us to operate. So I think our plea to all of you, members of the press and everybody else, is to sit down, let's deal with the consequences of food. Here Nakuru, by bus. Bus has maybe 70 passengers. So how many got into contact with that? And how many of the 70 again went to meet others? So it is a total catastrophe as long as there's free movement of people. So our plea to the national government, to the minister, and to the president, let's have a lockdown. Let's deal with the consequences of food and other issues. Thank you.
Does the hospital have the capacity to hold them?
We have the capacity to do up to 50. So, but 50 is a very small number. If you're talking of a reach of 100 for one, so if all of them were to be brought, it becomes a big challenge. Yeah, so I think I want to leave it there and to thank you very much and continue helping us to manage the crisis. Thank you.
Yes.